Recent scientific inquiry into the intersection of energy metabolism and neurodegenerative disorders has illuminated a fascinating and potentially transformative angle: how glucose storage in skeletal muscles might influence the progression of Parkinson's disease. While much of the traditional focus in Parkinson's research has been on the loss of dopaminergic neurons in the substantia nigra region of the brain, emerging evidence now suggests that what happens in peripheral tissues like muscle could exert systemic effects, potentially altering the course of the disease. At the center of this theory is glycogen, the storage form of glucose primarily found in the liver and skeletal muscles. In the context of muscle tissue, glycogen serves as an on-demand energy reservoir, particularly essential during physical activity. However, beyond its local role in fueling muscle contraction, glycogen metabolism may play a broader signaling role. Muscles are not merely passive engines of movement. They also act as endocrine organs, secreting myokines and other metabolites that communicate with the brain. These biochemical messages can influence neuroplasticity, inflammation, and even dopaminergic function. This line of investigation gains momentum when considered alongside epidemiological observations that physical activity, a behavior that depends heavily on efficient muscle glycogen turnover, is strongly associated with slower Parkinson's progression and reduced risk of onset. Individuals who engage in regular exercise often show improved motor control, mood regulation, and overall cognitive performance. The mechanistic basis for these benefits has traditionally been framed in terms of improved cerebral blood flow, neurotrophic factor release, and anti-inflammatory signaling. However, it's now plausible that energy storage and release dynamics in muscle itself might be an overlooked driver of these neuroprotective outcomes. When muscle glycogen stores are depleted or poorly regulated, systemic glucose homeostasis can falter. This could lead to chronic low-grade inflammation, mitochondrial dysfunction, and altered insulin signaling, all of which are known contributors to neurodegenerative processes. Moreover, there's reason to believe that the way muscles manage energy under stress might affect how neurons respond to oxidative damage or metabolic strain. The muscle-brain axis, long speculated but only recently quantified in animal and human models, may serve as a critical feedback loop that governs neurodegenerative vulnerability. This feedback loop might not only help explain why metabolic disorders like type 2 diabetes often co-occur with Parkinson's, but also why interventions like resistance training and high-intensity interval exercise, activities that profoundly stimulate glycogen turnover, can yield neuroprotective benefits. Nonetheless, this area of study is still in its early stages, and any excitement must be tempered with caution. While preclinical studies offer compelling biochemical and mechanistic frameworks, translating these insights into clinical therapies will require careful validation. Not all individuals with Parkinson's can exercise vigorously, and not all muscle glycogen dynamics are equal. Age, diet, insulin sensitivity, and even circadian rhythms may modulate this relationship. There's also the risk of overinterpreting correlational findings. Increased glycogen storage or turnover in muscle could be a consequence of healthier lifestyle choices rather than a direct causal factor in slowing disease progression. Furthermore, it's important to recognize that while energy metabolism is an essential piece of the puzzle, Parkinson's is a complex disorder with multiple contributing factors, including genetic mutations, environmental exposures, and disruptions in protein handling like alpha-synuclein aggregation. Muscle-derived energy regulation may be a modifiable pathway, but it is not likely to serve as a singular solution. Still, the positive implications are notable. If the muscle-brain metabolic axis proves to be influential, it opens up new, non-invasive avenues for intervention. Nutritional strategies aimed at optimizing glycogen storage, such as carbohydrate periodization or fasting exercise cycling, could complement medical treatments. Targeted exercise programs that emphasize glycogen-demanding activities could be personalized based on an individual's metabolic profile. Even pharmacological agents that modulate muscle glucose uptake and storage could be reevaluated for their neurological side effects or potential benefits. In essence, this research highlights an elegant idea. The health of our muscles may reflect and even help direct the health of our brains. A more holistic view of Parkinson's, one that includes peripheral metabolic health as a modifiable factor, may pave the way toward integrated prevention and treatment strategies that go beyond the brain. As we await more longitudinal and mechanistic studies, this hypothesis serves as both a cautionary reminder of the interconnectedness of human physiology and a hopeful signal that meaningful interventions may lie within the familiar practices of diet and exercise.